All right, good afternoon, everyone. We're going to go ahead and get started. Thank you all for joining us today. We're here to learn a little bit more about the HHS cybersecurity guidelines to protect your healthcare practice. I'm Nicole Unruh. I'm a senior marketing analyst here at Secure Now, and I'll be the moderator today. I am joined by President and CEO of Secure Now, Art Gross. Art, there's been a lot of buzz about this topic. Why do you think there has been so much interest in learning about these cybersecurity threats?
Hey, Nicole, how are you? It's good to be here. There's definitely a lot of buzz. This is by far our largest webinar we've had. We have over 500 people registered for the webinar, which, and I think it's because organizations realize that they're under attack from cyber criminals, and they're absolutely concerned. They want to know, what can we do to protect our organization? And we have a lot. I was just looking at the attendees here. We have a lot of our clients. We have a lot of our partners on this webinar. So, excited to be able to talk through a lot of these new cybersecurity guidelines and help a lot of these organizations.
All right. So I'm going to go over a few housekeeping items before we really dig in today. But while I'm doing that, I'm going to open up a poll just so we can kind of get a feel for our audience who's here. So the poll question today is, are you concerned about cybersecurity? So we're going to start off with the agenda for today. First, we're going to take a look at why the healthcare industry is under attack. Following that will be the biggest threats to healthcare. Then we're going to check out some of the cybersecurity practices HHS has outlined to really lower your risk level to those threats. Then we'll talk about what you can expect from Health and Human Services and the Office for Civil Rights in the future. And then the last item we're going to go through today is why you need a managed service provider and how HIPAA Secure Now can really help you there as well. So now the poll's closed. Let's see. It looks like, wow, almost 90% of the people in this webinar are concerned about cybersecurity. So the good news with that is we are going to go through this guidance that can kind of help you address some of those concerns.
I'd like to talk to the 5% that aren't really concerned. Well, that's interesting. So, all right, let's jump into it.
We'll refer to that as HHS throughout this webinar. They do tell us here, do not make the mistake of thinking that your practice, no matter how small, is not a target for indiscriminate cyber attacks. Malicious attackers will always exist, whether you're a small practice physician or the chief information security officer of a large healthcare entity. Your job is to make it difficult for these attackers to succeed. So following up with that, HHS has also called out this specific statistic here. They're saying in 2017, cyber attacks cost small and medium-sized businesses an average of $2.2 million. So that's obviously a lot of money, especially for a small size organization. And these two things here really show us that HHS is definitely concerned with cybercrime. So why are cyber criminals targeting healthcare?
Good question. And I think HHS is absolutely worried. And when you take a look at it, meaningful use has transformed this industry, right? 9 years ago, we went from mostly paper-based records. Meaningful use has incentivized medical practices and healthcare organizations to implement electronic health records, and very successful. So we have a ton of electronic health records. Unfortunately, security, employee training, it's lagged behind this transformation. I mean, staff are unprepared to defend themselves against cyber criminals. We also see a lack of IT resources. With this electronic health records and this transformation, we have very complex networks. We have state-of-the-art equipment and devices in healthcare organizations, and without proper IT support, it leaves these systems vulnerable. And the other piece of it is that medical records have a lot of value on the dark web, where criminals buy and sell information. And this data, it could be used for identity theft, credit card theft, insurance fraud, prescription fraud. So if you put all of those four pieces together, it's really no wonder why cyber criminals are targeting the healthcare industry. So with that said, Nicole, let's take a look at what the government and HHS is doing to help healthcare organizations.
Right.
All All right, so let's take a look at what the government is doing to help, with cybersecurity. When you take a look at it, HIPAA was written 23 years ago. In 1996, the HIPAA regulations were written and passed. 2003, we had the privacy rule that implemented. In 2005, we had the security rule that was implemented. And when you think about it, the iPhone wasn't introduced until 2007. So the rules and the regulations protecting all this patient information was written and implemented before we even had mobile devices, which is pretty amazing. Moving forward, the Cybersecurity Act of 2015 was passed, and it required government agencies to address cybersecurity. It required HHS to develop cybersecurity guidelines to help organizations. Then we had in 2016, we had ransomware guidance. HHS realized that ransomware was an epidemic, that it was really a threat to healthcare organizations, and they issued guidance on how to protect against ransomware, and it made ransomware a reportable breach potentially. And then just last year, we had in 2018, we had cybersecurity guidelines, which is really what is helping healthcare organizations now. Nicole, why don't you tell us a little about what the cybersecurity guidelines are all about?
Absolutely. So HHS created this cybersecurity guidance really for two reasons. First, they created it in response to the Cybersecurity Act of 2015. And this was really a mandate issued calling for the development of practical cybersecurity guidance to cost effectively reduce the cybersecurity risk to the healthcare industry. So, with that, they put this together. We also know HHS is seeing a major rise in cybercrime, especially in the healthcare industry. And so now they've decided to kind of start discussing that. So, with that, HHS broke this cybersecurity guidance down into a 4-volume publication. And today we're going to focus on the main document, which is where they go through the biggest threats to the healthcare industry. And we're also going to look at Technical Volume 1, and this is specific to small and medium-sized businesses. It's really where we get those recommendations for how to mitigate some of that risk.
Yeah, and the key part here is that this is written for small practices. A lot of times when you start to think about cybersecurity, you think about hospitals. HHS realized that small and mid-sized healthcare organizations are at risk, and they issued guidelines specifically for the small and mid-sized organizations. So let's take a look at what HHS considers the biggest threats to healthcare. The first one is email phishing attacks. And I'm sure everyone's aware of what phishing is. It's fake emails that appear to come from a trusted source. This could be family, friend, it could be Amazon, it could be Walmart, could appear to be someone in your own organization. Usually it contains a malicious link, a file, or an attachment, and drives you to a website that looks like a real website and tries to steal credentials. And this could be credentials to your EHR, to your bank account, to your email system. The attachments could contain malware, and that could try to infect your network with ransomware, which we'll talk about, or other types of malware. And phishing could lead to patient information being accessed or destroyed, and it's a major problem for healthcare. 92.4% of all malware is delivered via email. Email is the attack vector of choice of cyber criminals, and phishing is the #1 threat. Why? Because it works. We have employees that are falling for phishing emails. So as long as employees keep falling for phishing attacks, these attacks will absolutely continue, and it is definitely a huge threat, and it was the #1 threat that HHS has identified. All right, so let's take a look at the second biggest threat to healthcare, which is ransomware attacks. And ransomware is a type of malware that encrypts or locks files on a desktop or network and demands a payment to release that data. A statistic on the bottom here, there is an average of more than 4,000 ransomware attacks every single day since 2016. I mean, this is a huge problem. We know that healthcare practices and hospitals have all been victims. We've seen hospitals been under attack and basically had not been able to provide services for over a week. And you think about it, now that we have converted all of this paper-based information, created all of this electronic patient information, they're sitting in EHRs, if your network is attacked and the network is, completely encrypted and locked, you can't get to patient charts. You can't get to schedule. You can't get to information to contact patients. It's like literally without paper-based records, and if everything's electronic, ransomware is a huge problem because it will stop the ability to provide services to patients, and it's definitely something to be concerned about. And HHS, as I mentioned before, gave guidance that ransomware potentially could lead to HIPAA reportable breaches. So, if your organization is the victim of a ransomware attack and it encrypts your EHR, there's a chance that you have to notify every single one of those patients that's sitting in that EHR. This is a major problem, not only to providing services, but potentially to causing HIPAA violations. And ransomware is a huge threat, and there is no sign of it stopping anytime soon. It's working for criminals, and as long as it's working, they're going to continue to exploit that. The third threat that HHS has identified is the loss or theft of data or equipment. This is all about mobile devices. We've seen this problem for years now. We've been talking about it for years. With all this electronic data, it's very easy to copy that onto USB drives or to have files on laptops or smartphones or tablets. And we're seeing that employers are losing these devices, criminals are stealing these devices. And just last year, in the first 8 months of last year, we saw that there was 192 cases of theft of these mobile devices, leading to 2 million individuals having their information breached. You almost scratch your head that this is still a problem, but it's really the lack of encryption makes it even bigger problem. All of this data on mobile devices, if it's unencrypted and it's lost or stolen, it's a reportable breach. And as long as we have more and more mobile devices, which is the trend, and if encryption isn't being implemented, we're going to see this to be an ongoing threat. So HHS has definitely identified this as something that organizations should take a look at. All right, the fourth threat is insider, accidental, or intentional data loss. So when we think about cybersecurity, you always think about hackers and, in their hoodies and sitting in a dark room trying to hack into your network. But one of the biggest threats are insiders, and insiders are employees. And there's two things to worry about from an insider or an employee is accidental insider threats. Employees are humans. Humans make mistakes. And, an employee could send patient information to the wrong patient. They could take a laptop home and leave it in their car and have it stolen, or just lose their phone or USB drive. And insiders make are the cause of most HIPAA breaches. In fact, employee mistakes are 90% of all breaches are caused by employee mistakes. So, insiders, employees are a big problem from an accidental disclosure of information or loss of information. But there's also intentional threats. So you think about snooping. Employees have been known to look in EHRs and patient information on celebrities, on family members, on friends or neighbors. We see that happening a lot. But also because of the information being so valuable, there's been lots of cases where employees have stolen information and tried to use it for financial gain, identity theft, insurance theft, to access prescriptions. So, What the thing that HHS is saying here is that you should definitely be concerned about hackers and outsiders to an organization, but employees are a threat, whether it's accidental or intentional, and organizations need to focus on insiders as well as external force, threats to the company. And the fifth threat that HHS has identified is attacks against connected medical devices. So when we think about connected medical devices, we're talking about ultrasounds, EKGs, digital x-rays, heart monitors, insulin pumps, and pacemakers. In fact, in 2017, the FDA recalled 500,000 pacemakers due to a vulnerability that hackers could manipulate the pacing of the pacemaker and the battery strength. So if you think about these vulnerabilities, they literally, if they were exploited, this literally could kill somebody. But on the other hand, when you think about other connected devices such as ultrasounds and digital x-rays, a lot of times these systems are left unpatched or unmaintained, and they're running older software or older versions of operating systems. And those vulnerabilities could be exploited by hackers and gain access to a network, and then either steal patient information, introduce ransomware. So HHS has said that that you should really be focusing on connected devices to ensure that your network is protected and patients are being protected.
All right, thanks for going through those threats. So now that we know the risks to the healthcare industry and kind of what they're up against, what does HHS recommend that these practices do to protect themselves?
All right, well, let's jump into it. So HHS has given recommendations. And again, I want to reiterate, these recommendations are for small organizations, small and mid-sized organizations. They've put these in place because they knew this is what small and mid-sized organizations should, implement and use to protect themselves. The first one is email protection. So, we talked about ransomware, we talked about phishing, and HHS is saying we need to educate employees on spotting phishing emails. They need to know how to distinguish between a real email and a phishing email. They recommend sending simulated phishing emails. Think about it. This is the way humans learn. You teach them, you quiz them, just like when we were in school, right? You learned a subject, you took a quiz. That's exactly what HHS is recommending here, is raising education and awareness on what phishing is, and then sending simulated phishing emails and letting employees know this was a simulation. Next time it could be real. So, very important. And in addition to educating employees, HHS recommends better email security, and that includes business class email security. So, we see lots of organizations still using AOL, Hotmail, free Gmail accounts, for their email. And these are not business class systems. These were not made for businesses. It does not provide the protections, and you're sending confidential information such as patient information. They should not be used. In addition, HHS recommends that we have spam filters to try to filter out some of the phishing and the spam emails that are sent. Antivirus software to protect against any malicious code or attachments that could be in emails. And they also recommend email encryption. So if you're sending confidential information, whether that's patient information and confidential employee information, credit card information, the use of email encryption to protect that information. All right, the second recommendation from HHS is about endpoint protection. And when we talk about endpoints, we're talking about desktops, laptops, mobile devices, servers. And what they recommend on all of these devices is implementing antivirus, making sure that antivirus is up to date so it can recognize new threats, implementing encryption, so any data that is sitting on those laptops or desktops or servers or mobile devices are protected in case they are lost or stolen or accessed. and the use of multi-factor authentication. So multi-factor authentication adds an additional layer of security when accessing a system. So this could be in the form of a code sent to your mobile device or an application running on your mobile device. So, when you log into a system, you're not only using your user ID and password, but you have to enter this code as well. So the reason it adds that protection is criminals would need to have your mobile device in their protection to hack into a system. So by using multi-factor authentication, sometimes known as two-factor authentication, it can really help protect EHRs and other systems that have valuable information. The third recommendation is about network management. This is implementing business class firewalls to make sure that networks are protected from outside hackers and cyber criminals, that they're configured correctly to make sure that any traffic that is going outside, from the internet into the organization is protected, and the proper safeguards are in place. Implementing intrusion detection, something like an alarm system. So if someone is trying to break into the network, alarms will go off, and your IT resources will be notified to potentially shut down that attack, or to figure out what has that intruder tried to access. And network segmentation, and including Wi-Fi segmentation. So if you look at Wi-Fi, if you have patients accessing your Wi-Fi, you want that segmented from your actual network. So patients or visitors can't access any information that could be sensitive. You want to take servers and valuable patient information and put them on a part of the network that can't be accessed by guests or visitors, and potentially not by employees that shouldn't be accessing that information. You also want to implement physical security. So any servers that have patient information, confidential information, should be in locked rooms, locked server rooms, locked cabinets or closets. All right, looking at the fourth recommendation from HHS is all about vulnerability management, system patching. So this is ensuring that systems are kept up to date, any security holes or gaps are patched with updates from vendors. So that includes hardware, desktops, and laptops, and servers. Microsoft and Apple, they provide ongoing security patches, and these need to be applied. Any software, including your EHR, Microsoft Office, Adobe Acrobat, and those medical devices. So, the devices that you don't really think about, the EKG, the blood analyzer, so the digital x-rays, all those systems need to have ongoing patching and updates to ensure that those vulnerabilities aren't exploited. And then HHS recommends performing vulnerability scans. And these are scans to see, do all of these systems, have they been patched? Are they missing any patches? And it's very important to identify those patches, remediate those patches that are not applied, remediate those before cyber criminals can find them and exploit them. So vulnerability management is a very important recommendation. The next recommendation from HHS is all about incident response, to ensure that you're prepared before a breach. A lot of organizations, and HHS realizes this, especially smaller organizations, are not prepared in the event of a cyber attack, a data breach, and that preparation includes making sure that you have vendors ready to help you with forensics to figure out what has been breached, what hasn't been breached, legal counsel, breach notification to affected individuals, credit monitoring. And once again, it's really important to have this incident response before a breach occurs. If you start scrambling around after a breach, it becomes extremely stressful, and you may lose valuable time in trying to contain the breach and figure out what happened. Another recommendation is cyber insurance. As cybercrime continues, all organizations should evaluate whether they have the right amount of cyber insurance, and they, to have that in place, to have that financial resources in the event of a breach. So, incident response and cyber insurance is very important. And then the last one that we're going to look at today is ensuring that cyber policies are in place. Absolutely have to have policies for the HIPAA security rule, the HIPAA privacy rule, how to protect patient information. But in addition, you really should have cybersecurity policies, and some of those policies examples are acceptable use. What should employees do with their laptops and their desktops? What websites should they go to? What websites shouldn't they go to? BYOD policies, bring your own devices. These address policies around employees using their own smartphones, their own laptops. How do they protect data on those devices? What should they do with those devices? What shouldn't they do with those devices? Encryption policies, remote access policies. So if you have workers that are working from home, what should they do to protect the data that's sitting on their home PCs? What data should be there? What shouldn't be there? And then another example is social media policies. So these are policies around what should employees do to post on Facebook or not post on Facebook? What to do if a patient has a complaint posted on social media? Should you respond? So what HHS is saying here is organizations should be looking at cybersecurity policies. They should be implementing cybersecurity policies, and employees should be trained on those cybersecurity policies. They should know, what policies are in place and what do they mean, and how should they use those policies and understand those policies.
All right, so we're going to go into what to expect from HHS and OCR. OCR is the Office for Civil Rights. They're really the department within HHS that's responsible for enforcing HIPAA. So at this point, we know the threats to healthcare and some of those recommendations laid out by HHS to mitigate those risks. What can we expect to see from HHS and OCR moving forward now that they've kind of issued all this guidance?
Yep. So, we worked with over 100 organizations that have either been audited by CMS for meaningful use or they've been investigated by OCR. And, what we've seen in the past, when an organization has a breach, OCR, investigates that breach or a suspected breach, and they ask for proof. They ask organizations, show us proof that you have performed a security risk assessment. A lot of times they want to see the security risk assessment, that SRA was done before the breach and after the breach, and show us that you remediated the findings of that SRA. OCR is asked to show proof of policies that are in place, that you've trained your employees on protecting patient information, that you have performed network assessments and remediated those findings. So OCR is already asking organizations, if they had a breach or a suspected breach, to show proof that they have complied with HIPAA regulations. We believe in the future, now that they have released this guidance, that OCR will start to ask for proof that you have implemented cybersecurity safeguards. Let us see your email protections, that you implemented, business class email, that you have anti-spam, antivirus protections, that you have provided simulated phishing to employees and trained employees on spotting phishing emails and how to avoid ransomware and falling for a phishing scam. Show us proof that you have network and vulnerability protections, that you have firewalls and that you're patching and you've done network assessments and vulnerability scans. Show us your cybersecurity policies that are in place, your social media policy, and show us that you had an incident response in place before that breach. So we really believe that OCR is going to start to look into cybersecurity just like they look at HIPAA compliance. And the thing right now, one of the main things I want to drive home is that HIPAA compliance alone is not enough to protect healthcare organizations. We really have to comply with HIPAA, implement, the pieces of HIPAA, which is absolutely critical, protecting patient information. but it's really the cybersecurity aspects are going to protect you from cyber criminals and stop employees from becoming victims of these cyber criminals.
All right. So a lot of what we just talked about, it's not, your traditional HIPAA compliance. How can organizations go about implementing these guidelines?
Yeah. So, one of the things that you can see that HHS is calling, for these recommendations, and this is really continuous maintenance and monitoring of networks and continuous security, and that's usually performed by a managed service provider, outsourced IT, and we'll talk about that in a second. But in addition, organizations need HIPAA compliance and cybersecurity services, that they need to start to look at cybersecurity as part of a compliance package. So with that said, let's jump into what a managed service provider is. An MSP is a professional company that manages and maintains your network and systems, this outsourced IT. Typical functions of an MSP is email security. They implement business class email systems. They provide anti-spam, antivirus for email encryption. They do endpoint security, antivirus, encryption on desktops and laptops. They provide backup and recovery, disaster recovery of data on a network. They'll do network management, implementing firewalls and intrusion detection. They'll implement vulnerability management, patching systems and software, doing vulnerability scans. They can assist with incident response. And basically, they're responsible for ongoing maintenance and security of a network. And if you think about it, all these items listed here on the right, these are all the items that Health and Human Services, HHS, has recommended. So it is almost impossible to implement these cybersecurity guidelines without utilizing an MSP to help you with this. And then, in addition to that, we believe that HIPAA Secure Now can also help with not only HIPAA compliance, but with cybersecurity services. So, HSN has worked with MSPs. We have over 1,500 partners that are MSPs that we partner with. And so those services, those cybersecurity services, our partners provide. HIPAA Secure Now provides, compliance services, cybersecurity services, including employee HIPAA training on the security rule and the privacy rule. We have HIPAA and cybersecurity policies. So all of those cybersecurity policies that I mentioned, we provide along with the security and privacy rule. We performed over 10,000 security risk assessments. Where we believe our process is very streamlined. We provide HIPAA audit and breach help. So if an organization has a breach or is being audited by CMS or OCR, we will work with you to help you through that audit, help you submit the information that the government is looking for. We have our HIPAA help desk where we provide ongoing HIPAA guidance and answering questions that you may have. That's a big part of what we do. And I know we have a lot of MSPs that are on this call today. We have a partner program. We'd love to talk to you if you're interested in partnering with us. As I mentioned, we already have 1,500 partners. We're looking to expand that network. And next month, we will be introducing our new cybersecurity services, where we're going to provide continuous cybersecurity training to employees. We're going to provide simulated phishing, dark web monitoring to see credentials of employees that are out on the dark web and inform these employees of breaches they've been involved in. We provide cybersecurity policy. So we're really excited about not only continuing our HIPAA compliance services that we've been providing for 9 years now, but also to start to introduce new cybersecurity services that go along with what HHS is recommending. So, when you take a look at it, it's the combination of HIPAA Secure Now along with MSPs really are the way to implement these HHS recommendations. And, I think, when the main takeaway from this is that healthcare is under attack. Cyber criminals are targeting healthcare. They see this valuable data. They're targeting it and trying to steal or leverage this data through ransomware. And, HIPAA compliance alone will not protect organizations. You have to comply with HIPAA, absolutely, but you have to focus on cybersecurity along with HIPAA compliance. And, and I believe the HHS recommendations are, they're standard recommendations to protect networks, but a lot of healthcare organizations aren't doing this, and I really believe that these organizations have to start to look at these recommendations, implement it, and put those protections to keep cyber criminals at bay. All right. With that said, Nicole, do we have any questions from the audience around, any of the information we went over?
Yep, it looks like we have quite a few, actually. We will get to as many as we can, but if we don't answer your question, feel free to reach out to us after. The first one I'll take is, how can I get a copy of this webinar? We will be sending out an email following this webinar with a recording of it, so you can be on the lookout for that. Next question I'll take here is, my practice does not have an MSP. Can you guys recommend someone?
Yeah, absolutely. We, as I mentioned before, we have 1,500 partners in all 50 states, and we can absolutely recommend MSPs in your area. So just if you send us an email at info@HIPAASecureNow.com, be more than happy to make that recommendation.
Okay, then this seems like a lot. What should I do first?
Yep. So, the first thing that looking at what HHS has identified as threats, and that's email, that's ransomware, their recommendations about email security, it's about simulated phishing. That is the attack vector of choice for cyber criminals. Focusing on email and minimizing the way that cyber criminals actually make employees victims, I think is probably one of the most important. So, doing that simulated phishing, that education on, what phishing emails are all about and how to avoid it, working with an MSP to make sure that you have business class email, that you have, spam filters and antivirus and email encryption. I would absolutely focus on email and reducing the risk that email, presents to an organization.
Okay. Someone asked about a SIM tool. Do you recommend a SIM tool?
So, a SIM for the audience is a security information and event monitoring. And what that does is collects log files. So if someone was to try to, attack a network, that all that information of, what systems were accessed, what time, who, what IP address. We're not going to make any specific recommendations. There are a few that are very, cost effective and, are geared towards the small, mid-size organizations. We'd be more than happy to make some recommendations offline, but there's so many of these products. I don't want to start picking certain products and leaving other ones out. So I'd be more than happy though to give some recommendations afterwards.
Okay. We do have some pricing and timeline questions in regards to the cybersecurity additions to the HIPAA Secure Now platform. We can reach out after the webinar if you guys have any specific questions there.
Yep.
And,
and the timing is, we're putting the finishing wraps. I don't want to talk about pricing right now, but the finishing development work is being done as we're speaking, and we're looking at launching this towards the end of next month. So we're very excited about that.
All right. And that's about all the time that we have to answer any more questions for today's session. But again, if you do have questions, please feel free to reach out to us at info@HIPAASecureNow.com. And thank you all so much for joining us today.
All right. Thank you, everyone. And we look forward to continuing to work with you. Thank you.
All right. Bye-bye.